Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to this episode today where we're talking about why the roach. So it's an interesting topic and not always discussed, so I hope that you enjoy this episode. How are you going today, Sophie?
Hi, Raquel. I'm really well. This conversation is going to be interesting because there's just a lot we're going to talk about today. There's a lot of very interesting points that might be new information for people, and it's definitely not a perfect answer to a complex issue, but it'll be an interesting one.
Yeah, so I guess the first thing that people want to know is, what is a roach? So how would you describe a roach to people?
So a roach is also known as a kyphosis, and it's where the lumbar spine is curved upwards into a flexion. So it's you find the lumbar spine sitting between the rib cage and the sacrum and pelvis, and that area of the spine can look like it can be slight or pronounced, and it looks like it curves over, like almost like a rainbow shape in that area. And it doesn't have to be a perfect rainbow shape. It can be a little bit lumpy, and it can present in different ways as well. You might talk about the scoliosis.
Yeah, I've had a couple where there was a roach or a kyphosis, but the actual lumbar vertebrae were misaligned as well. So, like I have one horse where it was a squiggly kind of misalignment. So, like, a number of vertebrae were in different directions. When I started working with Jelly, he had a roach back, and I remember he was the first one, and I still don't know if I probably have come across other horses since, but I was going along his lumbar spine and they were all in a line, and then all of a sudden the last lumbar, or maybe his second last lumbar, because he kind of dips away there, was sitting completely off to the side. Like, it was not in the same alignment as his other lumbar vertebrae. And previously as a vet, I would have been like, that's not possible. Like, that those lumbar vertebrae are not aligned. However, now I understand with like soft tissue pull and that there is motion in those joints. And so, it was being pulled for some reason, and it was sitting over to the left, I distinctly remember. And yeah, it was not in alignment. And we were able to change that. I had it, change within a treatment at times where it would start to shift back into alignment, and now it sometimes goes a little bit out of alignment, like more what I've seen a lot of horses, and not so dramatically out of alignment. But he couldn't pick up his back legs, and like, if you imagine having two vertebrae which are sitting out of alignment, and what that does to the function of those vertebrae, as well as the spinal cord running through that area, like, he physically would just slam his back legs down. So it was causing a functional, sometimes we have these things and they're not causing an obvious functional problem. Like, your horse might have a roach, but you may not recognize how it's affecting their function. Like, they still may be able to do the things that you'd expect of them, such as lift their legs for the farrier, but that's not always the case. And for Jelly, it was significantly affecting his function. So people are going to ask, is it conformational or postural?
So there's a bit of a a debate there, and we've touched on it in other episodes about the fact that you have seen cases where young horses have had traumas and all of a sudden a roach has popped up. And you've seen cases where foals have a roach, but they've also had birth trauma. And we believe it's essentially postural. It's a...
Yeah, I mean, from a structural perspective, it has to really be postural, like unless there's a significant anomaly in those vertebrae. It's generally postural, but it can become conformational if it's not attended to, especially in a foal, young horse.
Absolutely. So for anybody who doesn't understand also exactly what the lumbar is, there is generally 6 bones, sometimes 5, depending on individual anatomy, and they start where the end of the thoracic spine is. So you've got the thoracic vertebra and the ribs coming off them, and then you have the lumbar spine that stretches up until the sacrum, which is also where there's articulation with pelvis. And so for me personally, before I studied equine science, and even then before I'd come to your subjects, to me, the lumbar felt like a bit of a grey space. The majority of the teachings that I would have received was just make sure the saddle doesn't sit over that area. You know, it doesn't have a lot of support. You know, it's a weak part of the horse. Some horses have a long, weak lumbar, etc. And there's just so much more to that space that I didn't have an understanding about. What else would you say about the lumbar spine?
Yeah, I mean, the lumbar spine is generally, you know, it's actually more well supported than the thoracic spine. It's just because the ribs are articulated to the thoracic spine via a joint, right? Whereas in the lumbar spine, the transverse processes are part of the vertebrae. And so there you've actually got the bone coming out there in that lumbar area coming across, and also underneath the lumbar area you have the psoas muscles and quadratus lumborum, although that's pretty poorly developed in the domestic horse, but there's actually muscles underneath the spine there as opposed to the thoracic spine, which majority of the thoracic spine has no muscle underneath the vertebral bodies. And it has limited motion compared to the thoracic spine. Like the thoracic spine has a much bigger range of rotation and lateral flexion and flexion extension compared to the lumbar spine. The lumbar spine is fairly stable. However, the small amount of movement that it has in lateral flexion and rotation is important. And it goes on to the lumbosacral joint, which has a large range of motion of about 20 degrees. But the lumbar region should be well supported. However, in majority of our horses, it isn't because of poor posture, really, and what the underlying causes of poor posture. So that's one aspect of it. In terms of anatomical structures in relation to the lumbar area, so there's joints obviously between the vertebral bodies like the other vertebrae. There's facet joints which allow the motion, like define the motion of the area. So they're above the vertebral body joints. Then we've got a lot of ligaments, just like throughout all the spine. Like there's ligaments underneath the vertebral bodies, there's ligaments above, there's ligaments between the spinous processes, and then we've got the big supraspinous ligament that goes over the top of the vertebrae that connects from the head, goes all the way to the tail along the lumbar. We've also got underneath, you've got the nerves, like the vagus nerve, for example, blood vessels, so the aorta that runs under there that supplies the blood supply for the hind limbs. So it's another important reason why we want that functioning. and the lumbosacral plexus, which supplies the nerve function for the hind limb muscles as well, and is super important for that. So, you know, there's a lot of potential anatomical structures that could become restricted or injured, especially when our lumbar is not well supported. The important muscles in the area, so we've touched on the psoas muscle, which is just very, very important muscle for horses for their postural stability. Like, I think we've talked about it a lot, but you know, it attaches from the last couple of thoracic vertebrae along the lumbar spine to, well, there's the psoas minor that goes to the pelvis, and the psoas major that goes to the medial aspect of the femur. Then it also has a relationship with the iliacus, which comes down to the pelvis area. And then the quadratus lumborum is the spinal muscle underneath the lumbar spine as well. But in the domestic horses, it's very poorly, in all the horses I've seen, it's really tiny, except for the conics, which were browsing and had just amazing core musculature. They had a really well-developed quadratus lumborum, so I think it should be better developed, but it's not because of the way a lot of our horses function. The other thing to note is that the iliacal fascial band kind of sits across that psoas area, and it's really important, and there's some other ligaments in there as well, but it's really important because I think in a lot of horses that gets very tight because of changes in the lumbosacropelvic function and hip function and weakness in the lumbar area. And then, you know, it can compress the psoas and potentially change the blood supply and everything through there. And we have the sartorius coming from the medial aspect of the stifle, and that comes up and attaches into that iliacal fascial band. So there's a big relationship there, which we're going to talk about, to the stifle and to the limb in general from that lumbar. And another important area is the myofascial lines. Would you like to just touch on those, like especially we're talking about the ventral myofascial line?
So there's the myofascial lines have been, you know, there's a textbook that's been created by Ricky Schultz and Vibke Brond, and they dissect out, you know, lines of muscle and fascia that creates support in directions. The ventral myofascial line connection, there's a few lines that create one particular support system. So the superficial ventral line, that one travels up the front of the leg and up into the groin. And then it goes via the abdominals and the pectorals. So the pectoral muscles at the front of the horse and travel all the way up to the mandible. So the jaw of the horse. You've got the middle and deep component of the ventral myofascial line. And these go from now the back side of the foot as opposed to the front, up the hind limb into the groin as well, and into the ventral spine area. So that's what we were talking about underneath the spine, including the psoas area, and then it travels up again up to the mandible, and it has a hyoid connection. So there's a connection between, you know, the head and the tongue and the hyoid traveling all the way through back up into that roach. And then you also have the deep component of that ventral myofascial line that follows the sartorius, which is the muscle that goes, you know, it's on the inside, the medial side of the stifle, and it travels up and it has fascial connections again into the psoas muscles. It's becoming our favorite muscle here. And these also, because that psoas muscle travels long ways from, you know, kind of parallel almost on a bit of an angle with the spine, it actually comes forward and it goes a little way through the diaphragm, which is, you know, the main breathing muscle. So it's traveling a little bit of the way into the cavity where the lungs and the heart are stored. So you can see there's a really deep connection into that all that space. And they also travel around the abdominal viscera, so the respiratory system and the abdomen. They're all really strongly connected with that ventral myofascial line.
Yeah, which then when we come into talking about like causes, you know, having a bit of an understanding of the relationship myofascially really helps you understand how different areas can cause a roach. So, you know, I've seen so many roaches, it feels like it's a really common postural issues. I have lots of stories. But one example I will share, which relates to our first cause of the roach, is stifle issues. And so years ago, I looked at a horse for a client. It had passed a vet check, this particular horse. So to pass the vet check, no obvious lameness. And when it moved, I thought, gee, it moves weird with those back legs. Like it kind of throws them around. And I remember when I put her on a small circle, to me, she looked a little bit lame. And she had a roach. And I remember saying to the owner, I'm not sure right now why she has a roach because everything was so tight, but I am concerned that there could be something underlying, you know, so just to be aware. Anyway, a couple of treatments later, we took away that compensation or the tension that she was really holding, and then she came up lame, which was great because then we could see it was obvious stifle pain, and the lameness was obviously related to the stifles. So then we sent her away to get x-rays, and she had massive chips off the end of her femur in both stifles. So obviously at some point she'd maybe jumped a fence and caught the stifles because it wasn't new, it was old. They did do surgery to remove some of it, but like she was never sound enough to ride. She produced some lovely babies, but yeah, so that was an example of stifle relationship. And so that stifle relationship is that relationship where, you know, if they've got stifle or hock pain and they're protecting it, they're generally going to stand in a bit of a contracted position, with the legs a little bit more kind of tucked under themselves. And so then they get that tension through the sartorius, through the psoas, and then, you know, it starts pulling that lumbar spine into flexion. So that's one cause. What else have you seen in terms of things that seem to be causing roach back?
Well, touching back on the iliopsoas complex and tension, because the muscle, you know, a flexion of that space means that, you know, the bones are actually being bent upwards or a little bit sideways when you're talking about the offset scoliosis that you were mentioning before, like you'd seen in jelly. The iliopsoas complex can have a lot of dysfunction in different ways. It can be tight, it can be inactive. The horse can compensate for issues with the iliopsoas, so using the abdominals that are right all the way underneath the belly on the bottom side of the horse's belly to make up for iliopsoas dysfunction and other areas too. That's one. Did you want to touch on the hip dysplasia?
Yeah, I'll just also go back to the psoas because, you know, I think that it's a difficult area to diagnose. And so that's why it's often not in traditional veterinary medicine, like it's not recognized as a common cause of an issue. But, you know, we do have vets that are rectally looking at psoas muscles and picking up adhesions and scarring and like you mentioned, like the tightness and weakness and asymmetry from one side to the other. And if your horse has had, say a back leg caught in a fence or caught somewhere, there's a high chance they've damaged the iliopsoas. Or if they've taken a big slide in the mud, and like the pelvis has gone into too much flexion, like that's another way they could do it, or their hind limbs have gone out behind them. So I think there's a lot of damage, like from trauma, but I think there's also the other aspect where it's a muscle that's not used correctly, and so it's often weak and tight, weak and not activating appropriately. And it's just such an important component, which we've mentioned over and over again, but such an important component to that whole postural stability complex of the horse. So yeah, can't reiterate that enough. And I think most horses that I treat have some degree of dysfunction in their iliacus or their psoas muscle, or and I suspect with Jelly, I'd love to get him ultrasounded in there. I haven't done as yet, but he used to tie up all the time, and then he did eventing. So the chances that his psoas was having little damage all the time, and considering the health of his lumbar, there's a chance that his psoas was pretty messy, and I'm doing a lot of things to try and help with that, but I think that's not uncommon. With hip dysplasia, so an example that I have is a little old pony that I've treated, that had quite had quite a flexed lumbosacral area, like no ability to extend in that area, was very sore through there, and then showed evidence of hip dysplasia in the way she stood and the way she moved. Through getting that area functioning, so over a few treatments, not only did her diarrhea clear up, which she'd had chronically for years, and this was a combination of what the owner was doing too to help with gut rehabilitation, but that lumbosacral plexus is also important for gut function. And so if they're stuck in, like the sacrum is stuck in it's restricted in its motion, lumbosacral joint's restricted in its motion, it can affect gut function. So with her, her posture was completely different once we got that lumbosacral area functioning. So that was another one. What else?
So you can have issues of the lumbar themselves. So I know you were actually just talking about traumas that have happened, such as slips, putting legs out behind, in front. I've seen a couple of horses that have, well, one in particular I'm thinking of, that reared over and landed on something in their lumbar, and they have had a fracture of one of the dorsal spinous processes, and it healed a little bit misaligned as well, vertically. So instead of healing nice and straight, the top has bent forward and has tipped into the one in front of it, they had x-rays done for that. But in the process of healing, there's discomfort surrounding that area. And so there's a lot of tension in that space as well. And there's a very slight roach and alongside a lot of tension. So you can have local issues there as well, traumas or other lumbar issues. We were talking about the fact that you can have, you were talking about hemivertebra in another episode, changes within the bones themselves, conformationally. Can you think of other lumbar issues you'd want to?
Yeah, I think depending, like facet arthritis could cause a roach, depending on where the pain aspect of it is. And there was something else that I thought of, but and they can get kissing spine in their lumbar as well, so obviously if it's a roach, it's usually more open, but that could lead to kissing spine in the thoracolumbar junction, for example. The other one would be relationship of the intertransverse joints, which is the transverse processes come off those lumbar vertebrae and out like into that lower back area. And the last two generally have a joint between them. They can become very painful when they're fusing, and they generally fuse in most horses as they get older. In mares, it's often earlier than geldings, but so in the process of fusing, that they could either roach from discomfort, or they could actually fuse in a misaligned position, which I've seen a lot with bones, where they've actually like fused with the whole lumbar out of alignment. So that's another issue.
And
Yep.
I was just gonna say, if anybody who's listening, it's popped up in questions before. Is it normal to fuse through the lumbar for horses domestically and not represent, poor health in those last few vertebrae?
Yeah, as far as we're aware, yes, it is. It just varies with when it happens. Like I've had a few horses where I've been treating them and they were younger. Like one was three, oh, 3, 4. I think they were both kind of around the 3, 4, 5 age, where they were just so painful in there at that time, and like nothing I really did at that time seemed to alleviate it. And so my thought process was, there's fusion trying to happen, and it just needs to settle out. So really, we probably just need to, there's not many things that I would say you probably just need to turn them out, but that's probably one where you probably just need to let them, like, get the body in the best posture and just turn them out and let it fuse without putting weight on their back, that's for sure. So yeah, that's with that. The other big one is the gelding scar. Like, it's a big topic of discussion often. But, I would say some horses I see, it more seems to affect sacral function. It's not always lumbar function, but then others that I've seen, it's really having an effect on lumbar and lumbosacral function. So, and the gelding scar, it just depends how far internally it's affecting. Like, for some horses, it could be more of an external scar, and then for others it could be much more internal, going right up into the inguinal ring and up into having a big effect internally. So I think that is something that if you see a horse with a roach, it's something you'd want investigated to see whether they do have a gelding scar and whether it's active, like whether it's reactive, and like how significant it is. So gelding scar definitely with the geldings.
Yes, and of course you've got to consider the girls as well.
Yes.
Mares have ovaries that can have adhesions. The ovaries suspended by ligaments within that abdominal area. They can have tension, fascial tension that can cause a lot of discomfort. Of course, that's abdominal area. There are other abdominal organs as well. The intestines, you've got the kidneys, all sorts of things inside that cavity that can have discomfort. And you were talking about the pony who had the intestinal upset that was supported by having a postural influence on her body. That's always an ever-present issue. Abdominal pain can have a really big influence. I mean, I myself, when I have an upset stomach, always have a sore back.
Yes.
Yeah, I'm never without, lower back tension and ache when that happens. And I'm altering my posture when that happens too. You're shifting around from side to side, how you sit in the chair, everything.
Yeah, so if you're, a horse and you're standing there and you've just constantly got that niggling pain and it's a bit of contraction through your abdominals, then, and that, we talked about the muscles like the psoas and the sartorius and stuff, but I also should have talked about the abdominal muscles in there too, because, if the abdominal muscles are under strain, that's also going to create flexion through that lumbar. And so then you can end up with a roach through there. And then we've got that connection, which you talked about, the organs and things with the diaphragm, which, requires an experienced practitioner who understands how to palpate for diaphragmatic function. But a horse that's got a very restricted diaphragm could, the relationship with the abdominals and the psoas could also have an impact on that lumbar spine. What else?
So we touched on this in the laminitis episode, laminitis and posture relationship, that hoof pain, particularly in the forelimbs, can have a big impact because of the way that the horse assumes a posture, leaning back. It often creates flexion through that space. So that's a chronic one, an altered postural stance, reinforcing, something like a roach, and the tension can sometimes be held even after the hoof pain has gone away. Like you were talking about posture becoming conformation, because it's a pattern reinforced for so long, it becomes the new normal.
Yeah, 100%. And then that happens with the hind limbs as well. Like if the horse has really negative plantar angle, so if you look at the coronet band and the angle that you follow from the back of the coronet band to the front, and if you draw a line through there, if it goes up above the carpa, so like if the angle is very steep, then that also is going to put the limbs more underneath the body, and that can create a roach. So that's where, like, we've done the episode on the body, how the body can influence the hoof, but that's an example of how hoof angles could influence the body. So especially with that negative plantar angle, that's a big one, that when you get that right, often their whole posture changes. So the roach can then be relieved in those cases often. The other one is rapid growth. So you see in young horses, if they're growing too quickly, or not if they're even growing quickly, but too quickly, but if they're just growing, bones are growing and the muscles have to stretch and keep up. And so if there's a rapid growth period, where all the bones have elongated, then that could put stress through the pull on the bones, and that could create a lumbar roach. So I remember, and also then it depends what work they're doing at the time of that growth. So I remember a standard bred that I treated years and years ago now. He was 2, he was in work, and he'd started locking up in his stifles, and he had a roach, which a lot of standard breds do have a roach. I think it's the stress that those stifles come under, and the psoas come under. But yeah, like it was a growth issue for him. So 1 or 2 treatments, locking stifle went away, evened up, so roach went away. It just had to allow his muscles to relax to accommodate the growth in the bones. So that was a big one.
Yeah, and I'll let you expand. This is a passionate topic for you concerning rib issues and foals.
Yeah, so we obviously did the episode on foals, but if they've got a rib issue and they're trying to offload that front end, whether it's through dysfunction or pain, or lack of function or pain, that could cause them to have roach in their hind end. It's a bit like the hoof pain in the forelimbs, except that it's in the thoracic area. But also if there is, their pelvis has been really compressed, like as they've come through the birth canal as well, like you can have that, they come out a bit roachy due to that. So, yeah, like I've had a few foals where they've had like quite a lumbosacral restriction through there. So important too that if you've got a foal or a growing horse that's showing indications of a roach, then yeah, please get them assessed by a competent, professional body worker who understands treating foals, because it will make a massive difference to what you've got at breaking in and starting, and their growth as well. So that's really important. What about
tack, big topic. Saddle fit, very important for back function and back motion, back comfort. just talking about the function of the lumbar, what it does, you know, saying there's very limited lateral motion. You've got a tiny bit of lateral rotation motion alongside some flexion and extension. And all of that can, when you have a saddle that doesn't fit very well, there's often a lot of tension or altered movement through the back as the horse tries to find the most comfortable way of moving for the saddle that they're wearing. And often that includes a lot of lumbar tension, a lot of restriction through that area. And it does link a little bit with the concept of overloading on a weak top line.
Mm.
You know, those structures all together, if you are compressing them incorrectly, even if they're developed or underdeveloped, you know, I've seen a good top line be negatively affected by a poor saddle very quickly.
Or rider.
Pardon?
Or rider.
Or rider, yeah. So those things have a really big influence. And just the function of the lumbar in relation to a saddle is almost always going to be altered if it's a negative fit for the horse.
Yeah, if they've got pain in the base of the wither, then it's going to influence how they can use that hind end and how they can create power from that hind end. Like if they can't lift up in front, then they're unable to use the power from their hind end, or if they've got all that pressure like at the back of the rib cage. And what I didn't say, like we're talking about roach in terms of bony, you know, change in the vertebral column, but there is another type of roach where you just get more of a swelling in that lumbar area. So like the muscles look swollen. And so you will get that with metabolic issues, gut issues, potentially maybe gut issues, and also poor saddle fit. So you see it a lot in ponies where they've got a saddle imprint, and then they've got this like raised lumbar area, which is often the soft tissues trying to stabilize for the poor function in the back. So that's really, really important. And like the weak top line that you just talked about, well, if they've got a weak top line and their psoas is also not, they're just trying to stabilize. So they're just trying to hold their lumbar there to compensate for the fact that posturally they're not strong and they can't support the load appropriately. So yeah, when you're getting those wither pockets showing up and where the spine is just generally becoming more prominent, then there's a problem there with function.
Absolutely. And so let's say you are an owner and you have found that some of these things, you know, your horse might have presence of a roach, pronounced one, a slight one, it's been there for a while, or it's just starting. What can you do?
I think the first thing you need to ask is why the roach? So, you know, have you investigated stifles and hocks? Have you investigated the psoas? Have you investigated the lumbar spine? Or sometimes the problem, like we said, is not in the most obvious area. So sometimes reducing the strain off there can be addressing other things like hoof balance or thoracic sling function or saddle fit. So, you know, it's and you're not alone. Like utilize your body workers, your professionals to try to figure it out for the individual horse. Exploring, you know, things like gelding scars and ovary tension, I think are really important. If you're unable to, you know, trying to figure out the underlying cause, like what are some things that people could do to help their horse?
So one thing would be postural work. Horses that have
Off the horse is what I would add to that.
Hey,
Off the horse, on the ground.
off the horse, groundwork.
Yeah.
Very valuable. We often mention it, the fact that when you have some sort of tension or poor muscular pattern, if you continue work, you are simply reinforcing the pattern that already exists. The goal is to change the pattern and then strengthen and reinforce a new, improved pattern that lends more function for the individual horse. So that might look like postural work, trying to introduce more function to the body. It could be, and all the causes we just talked about, sometimes they're connected. You often find multiples coming together because everything in the body is connected. So, rib issues and foals, they often also have hoof changes. They often also have, discomfort in areas, and a changed disposition. Their temperament is cranky, as well as possible roach issues. So lots of these things are connected, and postural work is a really huge, valuable, amazing tool that you can give every single horse ever. Even if you have good posture, you can continue keeping it that way. And body work. I know we've discussed body work, having somebody come along, but incorporating your postural work with your body work and your farrier, and possibly also your vet when there's, a genuine roach involved. Joint supplements can be huge also, supporting the whole body and also the lumbar area, helping to nourish the cartilage and the joints, increasing comfort, lots of natural anti-inflammatory. Sometimes, the Alleviate by McDowell's helps if you have a horse that, maybe has some related discomfort to a roach. What else would you be suggesting to people?
Yeah, I think like the Alleviate, especially in early stages, like to alleviate the discomfort. Yeah, and I think also with the joint supplements, supporting the lumbar and the lumbosacral joint, but it's also supporting all the distal limb joints to, every horse that I've pretty much seen under dissection has had some degree of change in the hock, for example. So, and it's probably an alignment issue in a lot of horses. Their hind limbs are not being used in a functionally aligned way. But we just want to slow down any kind of joint changes because they're not made to be ridden. So we have to look after them in that way. So yeah, in terms of takeaway messages, investigate your underlying causes of a roach. If you're buying a horse with a roach, I would be just to be mindful that there could be an underlying condition which could become evident later. And so you may want to try to investigate that before purchase. It is postural, it's not conformational. So you don't be fooled if somebody says, oh, don't worry about it, it's just conformational. I would still be asking the questions as to, well, why did that happen in the first place? So at what point did it develop in this horse? What's the postural reasons for that, even if it has become conformational? All right. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes. And find the links to our socials in the comments, along with the links to the Equine Functional Posture course and the next one that we'll be running.
See you in the next exciting episode.